In Rational Emotive Behavior Therapy, REBT, we often work with clients who become stuck in rigid interpretations and beliefs. What something means, what must be true, and what they feel they cannot tolerate. One way to gently open up that rigidity is by using a simple thinking tool called cubing. Cubing is just a structured way of looking at a situation from multiple angles to increase clarity before moving into change. In simple terms, cubing means looking at a situation from several different perspectives rather than just one. In therapy, this helps clients move from a single, rigid interpretation to a more flexible and accurate understanding of their experience. Cubing is not a replacement for REBT. It is a tool that can be integrated into the model. A. Activating event. What happened? B. Beliefs. Includes both inferences, what it means, and evaluations, demands, awfulizing, intolerance, global ratings. C. Consequences. Emotional and behavioral outcomes. Cubing is especially useful between B and D. It helps us examine and expand rigid inferences and beliefs before we move into full disputation. Then we proceed to D. Disputation. Logical, empirical, and pragmatic questioning. E. Effective new belief. More flexible, realistic, and helpful thinking. Let's take a common situation. A client says, "She didn't text me back. That means she doesn't care. I can't stand this." Using cubing, we might explore, describe what actually happened. She didn't respond to a message. Interpret, what are you telling yourself this means? She doesn't care. Alternative perspectives, what are other possible explanations? She may be busy, distracted, or planning to respond later. Belief, what are you telling yourself must be true? She must respond quickly, and if she doesn't, it's awful. Consequences, what happens when you think this way? Anxiety, frustration, urge to react. At this point, we can move more effectively into REBT disputation. Cubing helps clients. Cubing. Loosen rigid interpretations. Consider multiple possibilities. Reduce emotional intensity. Become more open to disputation. It is often less confrontational than immediately challenging beliefs, and can be especially helpful early in treatment or with highly rigid thinking. Cubing is a tool for expanding awareness, not an endpoint. It should always be integrated back into REBT by identifying irrational beliefs, actively disputing them, developing effective new beliefs. You can think of cubing as preparing the ground. It opens up thinking so that REBT disputation can take root more effectively. This material is for educational and training purposes only. It is not a substitute for clinical judgment, supervision, or individualized treatment planning. Clinicians should apply these concepts within their scope of practice and in accordance with each client's needs. Thanks for watching. I hope you will subscribe to this YouTube channel and look at other tools and techniques in psychotherapy.